Good morning, everyone, and thank you for joining the West Virginia Chamber of Commerce virtual series that recognizes and honors Black History Month. Every Tuesday at 10 a.m. During the month of February, we're going to hear from a noted West Virginian who has a unique and interesting perspective to share related to this month and to the issues related to diversity and inclusion in West Virginia. Some of our speakers will be will be talking about things in the future. Some will talk about things in the past, and all will be interesting. And I am thrilled to be able to welcome today as the first and premier speaker for this series, Dr. Shelvy Campbell-Monroe. Dr. Campbell is the Associate Dean for Diversity and Inclusion at the Marshall University School of Medicine and Pharmacy. She has an added distinction by her name. She has also recently become the president of the National Association of Minority Educators. So once again, West Virginia shines, and you are a shining example of what we in West Virginia have to offer the rest of the nation and the world. Dr. Campbell, it is wonderful to be with you. Thank you for taking some time this morning to make this presentation. And I'm just going to begin by asking you to talk a little about your background and where you're from and what you might want to add into that conversation. And also perhaps just add to that what goes through your mind as you think about Black History Month and those things that we could be paying attention to, celebrating, or learning about. So, Dr. Campbell, the floor is yours, and welcome.
Thank you, and good morning, and thank you so much for inviting me this morning. I am thrilled to be here and excited to talk a little bit about some of the things that, history, and then some things that are happening now, where I am at the School of Medicine. So, and I'd also like to thank all of those who have joined us this morning. A little bit about myself. I'm a West Virginia girl. So I was born in Mingo County and raised there, Williamson, West Virginia, which used to be the heart of the billion-dollar coal field. And I say that because, that's what it was. Williamson will always be my home. I actually have lived, within the Kanawha County area for many years. I participate in a lot of different things in the community. I serve as the leadership board chair for the West Virginia Arthritis Foundation. Arthritis is a very debilitating disease. And it's something that's very close to my heart, one, because I have it. And other things is because I look at, people around who also have it. So I do a lot of things within the community, a lot of outreach. I enjoy, spending time with the youth, working with them to help develop. And so that's kind of, a roundabout information about me. And in terms of Black history and Black History Month and what it means to me, and I think about those who come before me, it's a chance to reflect on the legacy of many of the pioneers. And also, it's an opportunity to celebrate. And it's also an opportunity to ensure that we do not become complacent about our goals and the goals that are there. And so Black history to me is really something that, I think about and study all year long. And I think that's important to say, but it is definitely the chance to reflect and to honor those who have come before us, so that, we're standing on those shoulders.
Really knowledgeable about the rich history related to medicine in the African-American community and the African-American physicians who were working in the Huntington area in the last century and even in the late 19th century. I wonder if you could talk about some of the unique experiences and accomplishments that occurred as a result of their work. I know our audience would be very interested in knowing some of that history.
Sure. And I think about, although there's several, I specifically think about Dr. Mildred Mitchell Bateman, a remarkable woman, a psychiatrist who many known by the state hospital for, that's what bears her name. And so it's very appropriate to honor Dr. Mitchell Bateman for her contributions to mental health, to the state, and to Marshall University Jones C. Edwards School of Medicine. Dr. Bateman became a physician, or she wanted to become a physician since, I think, age 12. And from the things that I've read, she worked with the Red Cross workers caring for tornado victims. She graduated from a women's medical college in Pennsylvania. She trained in psychiatry at the Manager Clinic. She also, which is very important, became the superintendent at Lincoln State Hospital in West Virginia, which was then a psychiatric hospital established for African Americans. She developed innovative and different programs with the patients. They were who I think many deemed hopeless, and she promoted treatments that were psychosocial, rehabilitation type programs. Being the first African American woman to run a state department, she served the West Virginia Department of Mental Health. In that role, she probably advanced many programs, and I remember reading that specifically with West Virginia mentally ill. She also was the first African American woman to hold an office in the American Psychiatric Association. She served, I think, as vice president. And so she really served as the founding chair of the Department of Psychiatry at Marshall, and she developed a strong department. Her focus was on the education of medical students, which is what we do. And she arranged for, I think, students to have clinical rotations, which later became, I think, her namesake, the Mildred Mitchell Bateman State Hospital. So, as I read about, Dr. Mitchell Bateman, she was described as being a very humble, tireless individual with a passion. And I think that's very important. It was a passion for those who had, mental illness. And so I think that was, a very important contribution to Huntington. In addition to that, another individual that, I'd like to mention, and of course, it's the Barnett Hospital. And the Barnett Hospital, the location was the first African-American hospital founded, ran, and treated by African-American people, which was a very monumental piece of history. The Barnett Hospital was named after Dr. Clinton Constantine Barnett, and he was a Black African-American physician. And after the National Medical Association was created, I think it was in the 1800s, African-American physicians and communities, they began creating Black hospitals to fight the increasing health disparities created by the segregation within the health systems. And Huntington was no different. I believe I remember reading that there were several hospitals that were within the area that would not treat people of color, Black people, African Americans. So the Barnett Hospital, when it was open, it was during a time period when many of the hospitals started off in physicians' homes. And so I think about, the Barnett Hospital, it started off with maybe 25 to 30 beds, and then it grew into, more beds, I think up to 50. There were operating suites. There were different types of X-ray and other type facilities. And it also employed, African-American Black physicians. Nurses, because it also became a place of training for nurses, Black nurses. And think that this time, African-American men and women from everywhere would want to train here in Huntington at the Barnett Hospital. And so I think that's monumental to talk about. And also too, I know that, the Barnett Hospital, it became later I think the city of Huntington became, the owner of it. And it became a hospital that served everyone, Black and white patients. And so I think about, this particular hospital and the contributions that Dr. Barnett and his wife, who was a nurse, that they brought, to Huntington, and how they continue to, shortly continue to work on training and treating Black people, which at that time, they were not getting that treatment. And so these are where I think our health disparities have, continued to come from, is not being able to treat those individuals who are, Black and or those who are marginalized. And so those are just a couple of examples of some of the history. And I know that, some of the speakers coming on have some deep history, because I know that, the upcoming speakers will have some additional things that will add to that. But these are very important within the medical area. And I think that, our medical students, are some things that they learn about. And it's also some things that, I try to teach, or we try to teach our youth during the summer, that we'll talk more about.
I'll add on a personal note, I had the honor of knowing Dr. Bateman, and she was a wonderful, wonderful person. The saying that still waters run deep certainly would have applied to her. Often when she was in a room, she might be the last person to speak, and she might also be the person who had the most to offer and contribute to the conversation. She was a wonderful, wonderful person. I'm curious, are we doing enough, and can we do more to honor the memory of some of those pioneers, particularly in the African American community, the Black physicians and allied health providers who provided so much important care when it was so greatly needed?
Oh, yeah, I definitely think so. I mean, health and healthcare disparities are where we refer to the differences in health and healthcare between groups. It stems from other broader inequities. And so when you think about the legacy we want to continue to honor, of course, we have to continue to learn about this history and things that came before us. But in addition, we have to continue to confront the impact of the inequality and racism, coupled with the lack of access to care for, many. Those are some aspects of medicine. And the medical community has a duty to confront, as we continue to care for, those individuals that, within our care area. We have to think about those differences and the importance of, looking at representation and being able to serve all individuals. And so, yes, I think that continuing to, learn about that history and bring forth that history so that, individuals know that it's, this road continues. We have to continue to work together in order to reach a goal. And one of those would be to, reduce the health disparities. And so lots of things go into that. But that would be definitely a way for us to continue to honor the legacy.
I think you've begun to answer the next question, but I want to just sort of go there anyway to see if there's more that you want to say. And that is, how can we think about the importance of representation for Black physicians and allied health care providers?
That's a good question. I mean, it's a great question. And I think about, there's been so much mistrust over the years within the Black community, with the healthcare system in general, and I say that with, the Henrietta Lacks, the Helo cells, and, not knowing that those cells were being used, over time. So that, definitely created a mistrust. And then also the Tuskegee study, with this syphilis, and then, not giving the care that was needed and doing things without knowledge and consent. And informative type things. And I think those are, some important things as many as, within the African American community, navigating the healthcare system. They have to come to terms with that history and that mistrust, and being able to show that, truly they're there to help individuals. And I think that's something that, nationwide, I think we continue to, have to think about, being able to bridge that. Not sure how, but that's something that we have to think about. And I think many of the health disparities also, during COVID, which was, a deep period, for everyone, thinking about the responsibility that we have, the misinformation, about the COVID vaccine and all those other things that surrounded the disparities in care. We have to continue to think about that. So it's very important to have representation. I think studies have shown that, having the representation of those that look like you and that, you're able to relate to. And I think about pharmacists, in that sense, being able to keep, people on the regimen. There's you're talking to someone that looks like you, and you have that trust factor, the same as with physicians. And I remember reading, maybe 2 or 3 months ago about an article on, whenever patients leave the doctor's office, how 80% of those patients are questioning what they're supposed to do. And so that means that we have to, continue to train our medical students to, to be able to communicate. And to be able to bridge that trust so that patients are able to, our health disparities become better. And so I think those are, just a couple of things to mention in terms of representation. As we have to continue to work towards diversifying, the face of medicine also, and that you can't get, diverse physicians if we don't have diverse medical students. And so those are, other things that, we continue to work on, but just a few, areas of why representation is important.
Well, speaking of the importance and life-saving manner of diverse physicians, you have made me aware of Dr. Charles Drew, who pioneered work in blood banking and transfusions, and whose work led to the creation of the first blood mobiles and the collection and storage of blood. But not all of us would be aware that we had a period that blood was kept segregated. And I wonder if you could just expand on some of the information that you have about the struggles related to having blood for all people and the mixing of blood. And because there's a very not only interesting and insightful background to be had, but also some real life-saving lessons that have come from a diversity lesson related to Dr. Drew.
Absolutely. And I think Dr. Drew, his work was not without struggle. There was such a protest against the American Red Cross, the policy of segregating blood. And I think that, stemmed from a lot of the implicit biases and things that came along, during that particular period. And then it also, goes back to other roots of things of, racism and other type things that, happen along the way and still continue really are there. And it's daunting that still we see that in the care of individuals. But, I think about with underrepresented, individuals often with that, students and individuals often face a complex mix of things when they're trying to move forward with, entering med school and going to med school. And some of these things and ideas and things that were set forth with, segregation of blood, not mixing the blood, being that, by having this blood and the mixing of the race and these kinds of things, I think were evident in the historical segregation, racism, the root of those specific things. And I think that was a struggle at that time. We still think about, things such as, the Flexner report, when Abraham Flexner, was commissioned to go in to look at all of the different medical schools and then make a decision on which schools were viable and which weren't. And so I think all of these things have that structural racism angle, with specifically the struggle with Dr. Drew and those, trying to ensure that the bloods were not kept separate. And I think that, he pushed along that blood is blood, the cells are there. And I think that sometimes we let other things or things were clouding, the diversifying the medicine angle and, being able to save lives, with blood as, the blood type. And so I think that, and it gets, I think it's very rich history and things to, I guess to more or less be able to go back and research and to look at, because we find that now we often have people that it's the blood type. And I think that's something that I think that we're missing along the line. And, going forward, I think about, individuals that are trying to get into med school, med students, and as they're looking at facing complex mixes of needs and gaps and things that sometimes the inequities that happened before keep them from being able to realize their dreams as they move forward. And these type things, such as the separation of blood, Dr. Drew's work on trying to ensure that the mission of diversifying that particular angle moves over into the future. And so just kind of, touching a little bit on that and not getting too deep in it, I think the Dr. Drew's research transformed, blood banking, transfusion methods, and then it led to the creation of the blood banks that we often use now. So just to kind of cap that off, it's very important to, to continue the research in this angle and continue to share that research so that we can debunk myths and things that, maybe are in things that people were thinking about or has been handed down that weren't not necessarily true, or the biases or the implicit biases.
If you could talk a little about what you see as the key component or the key components the organization should be thinking about as they strive to be more inclusive and more diverse and to do the job that I think all of us hope can be done toward making all welcome in all of our organizations?
Well, I think we have to build institutional capacity for diversity, equity, and inclusion. And I think in academic medicine, to achieve that particular standard, you have to have a deeper engagement of the medical school mission, one that considers, diversity as a core to excellence. And it also has to align the key institutional elements, identifying diverse talent, diverse leadership. Diversity and inclusion are large tasks to elevate. And so comprehensively, there's different strategies that, different organizations have to use. But often strategies should be proposed to address the disparities in the different groups so that you're making diversity and inclusion an essential element of both the short and the long-term strategies. So embedding diversity and inclusion throughout the organization is very important. And that starts one with the mission. And then being able to multiply diversity and inclusion, the impact with the external, enter your external partnerships, maximizing maybe the role of your employees, maybe the resource groups and the affinity groups is some things that we do. And then maximizing the role of your diversity councils. Each one of the hospitals have, where we are, St. Mary's, Cabell, they have diversity councils, diversity committees. And so you'll be able then to leverage your diversity and inclusion and use that as an innovation, not as something that you're just pulling in as an outlier. So you really have to leverage your diversity and inclusion. And we know that, businesses have researched and talked about it, for many years. In medical education, it is the same, but yet it's additional angles because at all levels, when you're trying to, move the elements of diversity and inclusion, you have to have your upper leadership engagement. And that means to being part of the mission. And then, the other thing is sharing your diversity and inclusion, your best practices, being able to, show where diversity and inclusion made those differences, and then how that diversity and inclusion continues to add, to not just your bottom line, but your overall environment, and your inclusivity of everyone. And I think that's very important. But I think really just building your institutional capacity is where you have to begin, and then it has to be embedded, throughout your mission and your strategic plan. So those are, some things I think that are key components. And it's more than just checking the box saying, hey, we've got, this many employees here that, fit this particular area and this many here. We have to think about all elements, our not just our ethnicity and our race. We have to think about our those who are disabled. We have to think about those who identify as, LGBTQIA. And we have to think about, all of those individuals and all of the unique perspectives and backgrounds, and really having an open ear to think about how those experiences may or may not be different from the things that you're tackling. And so I think that those are just, a few suggestions, but some things that, we have been doing, at the School of Medicine, and we continue to do, because we often go back and we have to look at, our diversity and inclusion metrics and the things that, we're doing to ensure that we are, being inclusive, and we're going back and ensuring that we need to, things that we need to, shore up a little bit to ensure that we're meeting those goals. So those are just a few, ideas and things that I think are very important to drive diversity, and make it more than just, a checkbox.
Thank you, Dr. Campbell. You have touched on this a little bit, but if you could expand on some of the initiatives that Marshall University's Joan C. Edwards School of Medicine embarked on in realizing the goal of creating a generation of well-trained physicians and surgeons to meet the needs of a growing population.
Oh, yes, absolutely. I mean, we actually have the diversity and inclusion metrics and initiatives that are part of our strategic plan. And so, as I mentioned, that's kind of a start. In it, we also have, we work together, as a group, and diversity and inclusion and the office, that I'm a part of, is included in undergraduate medical education, graduate medical education, and we have pathway programs where we are, we're trying to train, the next generation. Specifically, with the many that we have in my office, we have a healthcare pathway initiative for high school students. This particular program is for, underrepresented students, and it's giving them the opportunity to see the day in the life of individuals who work in not just healthcare, but all the STEM areas. And so I think that's, very important. The science, the math, these students need that exposure, some that maybe they have never had a chance to have over time. And so this is one way where we're trying to kind of prepare our students to meet that, considering that, West Virginia has, in terms of our diverse, population outside of white, it's, a very small population of Black and other, populations. And so we have to think about growing those populations, especially if we want to keep, those individuals here. The time is to work with them early. We have a Student National Medical Association where our students are working with the grade school, which is, these students through the third grade forward. And so this is a good time to prepare these students so that they recognize that they too can become, physicians and or pharmacists. And so that's, another important initiative. We also have, we're working with building the next generation of academic physicians where, our residents are able to participate and work with other residents across the country. They're able to publish. And then they do a lot of work with my pathway programs. They come in and they do suturing and other things. And so we continue to work to try to diversify medicine in terms of, our, bringing in students, preparing them so that they're ready for medical school and they can be successful physicians. And so those are just a couple of snapshots of things. We do so many things, throughout our curriculum with our, working within the communities for, health disparities and learning about public health. And so there's a variety of things that, we continue to do and we continue to evolve. I think where this is concerned, I'm pretty proud of that. As you see, I'm pretty passionate too, so I don't want to keep going on and on, but those are just, just a few things that we do. And I think it's also very important to mention that, all of our departments within, Marshall, whether it's the clinical side or that, we work very closely together. And I think that's important to bridging, that gap of students, understanding and being able to have exposure to all of these individuals and seeing that we work together as a team, which is, another important aspect of medical education.
Thank you. You've highlighted a lot of great programs and career pathways. Are there any other organizations that you'd like to highlight?
Well, I would be remiss if I did not talk about the National Association of Medical Minority Educators. It was established in 1975. I am, the new sitting president. And it was established by a group of educators that were very concerned about the shortage of minority healthcare providers. Look at that. It's a link to the things that we continue to do. And so this organization was established, during an important time, and we continue. At first, it was established just for medical school, but now it's all of the health professions. And so this is a lead organization in providing informational resources, training and advocacy, to any stakeholders that are working to ensure diversity in the health professions. And as the national president, I'm excited to know that NAMI, we continue to dedicate ourselves to developing and sustaining productive relationships while we're ensure that there's racial and ethnic diversity in all of the health professions. And so I'm excited to continue to work with NAMI. NAMI truly is where inclusion and diversity meets the health professionals. We work across the continuum to continue to work together to train not only our constituents and our members, but also those future healthcare professionals. And so and NAMI is, you can see it's my heart. It really helped me to learn about, medical education as a whole. And so I continue to want to serve and we continue to do things. We have Ask NAMI sessions where, students are able to come in and listen to or ask questions to a group of individuals who are across the country, who at different medical schools from you're at Yale to, the University of Hawaii. And so this is a great organization. I hope to be able to do it justice and continue to move us forward. But I think that as we continue to look at NAMI and then, other diversity and inclusion officers and others across the nation to provide critical guidance, to professional development and other things so that we can continue to diversify, our face of medicine. And provide opportunities for those individuals who are marginalized or those who are underrepresented.
Thank you so much for your time and expertise and your insights. And do you have any closing thoughts or food for thought as we move forward?
Well, I think I kind of do. I think that we really need to continue to improve diversity within the healthcare. I think it's essential that we continue to open opportunities to groups who are underrepresented in medicine. This way, we can continue to work on reducing our healthcare disparities. We, in the medical field, we can continue to improve our patient outcomes. We can expand our research and our protocols, and we can enhance our medical education. I think that several institutions across the nation practice holistic review of candidates. They implement different things to try to continue to diversify. And I think that the time is now. We have to continue to work to build a systematic leadership, to culture building, and maybe recognizing and reducing biases, and intentionally building diverse teams. So these are, I think my last parting words. I think that the time is now. We have to continue to promote diversity, equity, and inclusion. And we also have to continue to work together. So with that being said, I thank you so much for the opportunity to share, to talk about some things that we're doing at the School of Medicine, and for your time.
I want to jump in and Kaylin George, who is sitting to my right, and I didn't introduce Kaylin as we began because I think I was just too eager to hear from you, Dr. Campbell. So Kaylin, I should have introduced you, and I apologize. I'll try to remember to do better the next time. I want we have a large and engaged audience here today. We've gotten some questions in the queue. One is, will this presentation be posted on the Chamber's website at wvchamber.com? And the answer to that is yes, it will. Also, Dr. Campbell will be speaking at the end of March at the West Virginia Chamber's Women's Leadership Summit. So we're thrilled. I don't even know if that's been announced. When I said Kaylin might elbow me, I think it was on that one that I might have gotten an elbow, because some of those are surprise announcements. But I'm thrilled that you will be coming back and we'll be able to talk in person. And I would add, without, I guess I should say, potential spoiler alert here. Those of you who get the Chamber magazine know that we've had Dr. Patrice Harris on the cover of the magazine, former president of the American Medical Association, and like Dr. Mildred Mitchell-Bateman, a psychiatrist. And we have another surprise guest who we hope to be able to announce for the Chamber's annual meeting and business summit at the end of August. So we're gonna continue to do the very best we can to pick up on the threads that Dr. Campbell has left for us to try to weave together. And we've had an exciting program this morning. Kaylin, any final, our goal is to make these programs so that people can tune in and see the whole thing without having to get up and take a break. So we're probably about there. But again, let me say thank you to everyone who tuned in, and especially thank you to Dr. Shelvy Campbell-Monroe for such an outstanding presentation and an inspiring presentation. Thank you so much.
Thank you, Dr. Campbell, and we look forward to seeing you at the end of March at the Women's Leadership Summit.
Thank you, Caitlin, and it was wonderful, and thank you both. Have a great day.
Thank you.
Have a great day.